Diabetes, very simply put, is a condition where your blood sugar levels are too high. And pre-diabetes is essentially where your blood sugar levels are high, but not high enough to hit the levels of diabetes, but then not low enough to be considered normal as well. When your blood sugar levels are high for a long period of time, that can damage a lot of blood vessels in your body. When the blood vessels in your eye gets damaged, that can lead to blindness. When the blood vessels in your kidneys get damaged, that can potentially lead to kidney failure. When larger blood vessels are involved, that can cause things like heart attacks, it can cause things like stroke. It can also lead to what we call peripheral vascular disease, which is associated with gangrene and sometimes even lower limb amputations. You should see an endocrinologist if you have a complex type of diabetes. So for example, type 1 diabetes or gestational diabetes, or if your diabetes is not well controlled, or if you have complications already arising from diabetes itself, that's where you should consider seeing an endocrinologist. So I think one of the biggest mistakes that people tend to make with regards to diabetes is to underestimate the long-term damage of having high sugar levels. When the sugar levels are high, it's actually silently damaging your blood vessels and damaging your body. Patients may not have much symptoms and complications tend to take time to develop. I think this leads to a lot of inertia, and it leads to delayed action in seeing doctor, delayed action in taking medicines, and I've seen patients who are reluctant to start medicine, especially things like insulin, even though their sugar levels does call for it. And unfortunately, they may develop complications many years later because they've missed the boat and missed the opportunity to control the sugar levels when it's still manageable.